Doc Steve here, and I started this series on the death count and whether it's accurate months and months and months ago. But due to a lot of stuff on my plate and the fact that COVID is kind of getting a little less concerning over time, I haven't gotten to finish it. But I do think it's important to finish because I think it is important to know how bad or not bad this pandemic was. So I am going to finish it. To be honest, I'm a little sick of the whole Goldilocks analogy, but I started it, so I got to finish it. And the Papa Bear people are those folks that think that our death count is way overblown and there's been way fewer deaths from COVID. I talked about their two main arguments in the first two videos. Today, I'm going to talk about the Mama Bear people. Those are those folks that think that the official death count is way under what it should be. We've had way more deaths from COVID, and I'm going to talk about their stuff today. So what did the Mama Bear people use to try and justify this idea that we've had way more COVID deaths than what the death count suggests? Well, they use a category of public health statistics known as excess death statistics. Now, what is that? Excess death statistics are the number of deaths over what you would expect in a certain area during a certain time period. Before I get into this anymore, I have to make sure that you understand really what I'm talking about with excess death statistics. Now, I made a whole video of this trying to explain this in words, but quite frankly, it didn't really work. So Doc Steve's going to go graphic, okay? And I don't mean graphic in terms of the movies. I mean graphic in terms of, well, like graphs. So take a look at this bar chart. This bar chart shows the total number of deaths in the entire US every year from 2010 to 2019. Now, the first thing you might notice is why is it going up? I mean, are we doctors getting less good at treating people and so that more people are dying? No, thanks for playing. We are actually getting better at treating most things, and the death rate is gradually going down. However, the population of the US is constantly going up ever since day one, so therefore there's more deaths, even with a declining death rate. So if you look closely at this chart and crunch the numbers, you'd see that the death count in the US goes up around 40,000 every year in those 10 years. And if you look even closer, you'll see that there's 1 year there, 2015, where the death count went up 86,000. Now, this is the garden variety everyday use of excess death statistics. Public health people are going to look at that 86 and say, why did that happen? And that's the general use of this. But excess death statistics have an extra use during a pandemic, and that's to help you figure out if your official death count has picked up all the deaths due to the disease. Now, here's the bar graph with 2020 and 2021 added in. Whoa, what happened? Well, we know what happened, right? COVID happened. Instead of going up 40,000 a year, or about 1.5%, it went up 535,000 in 2020, or almost 19%, and the numbers are similar in 2021. So why do public health people think this data proves that there's been more deaths from COVID? Well, in this next bar graph, I've put two arrows in. The bottom arrow shows just the garden variety increase in the death count of about 40,000 a year. On top of that, the second arrow I've placed where the death count would be if you added in the official death count to both those years. And you'll notice at the top, from the top of the bar graph to the upper of the two arrows, there's a gap there. And that represents deaths that happen that you cannot be explained by the normal increase that happens every year and cannot be explained by the COVID death count. And that's the excess death statistic gap that public health people look at and say, we got to be missing lots of COVID deaths. So that gap amounts to about 145,000 in 2020 and about another 45,000 in 2021. So between the 2 years, 190,000 deaths not accounted for by normal increases that you'd expect, and also from the official COVID death count. So where are those deaths coming from? So oddly and interestingly, many of the Papa Bear people look at this data and use it to support their arguments too. Early on, there were some that actually said there wasn't really any excess deaths or very few excess deaths. I'm not going to talk about their arguments. I mean, frankly, the posts that I saw for those things were severely math challenged. And to be honest, given how many likes they had, we have a lot of math challenged people in this country, which is a little depressing to me. But the main argument the Papa Bear people make is that all these excess deaths aren't from COVID. They're from people who committed suicide, say, because they lost their job because of the shutdowns, or they had a heart attack and they were afraid to see the doctor, so they didn't go in and they died at home. So a lot of arguments about dying from factors having to do with the response to COVID and not COVID itself. So obviously there were a lot more deaths during the first 2 years of the pandemic, which we really can't attribute to the death count. But the real question is this: were those COVID deaths, or were they somehow otherwise related to the pandemic, including possibly even patients who died as a result of the response to the pandemic and not the pandemic itself? So given the controversy about this, I'm going to take the last couple of minutes of this video and go over certain categories of patient deaths that might explain that gap that we see between the unexpected deaths for those 2 years and the actual death count. And I'm going to tell you, number one, are they reasonable possible explanations for that gap? Number two, do they count as COVID deaths? And number three, how many I think fit into each category? So the first category is people who died of COVID without ever having a positive test, including people who never got tested and people who had a falsely negative test. Now, is this one a rational possible explanation for that gap? Absolutely. Early on, especially, the testing was poor. It was very unavailable. And this includes also people who never actually even saw a doctor but died at home without having gotten tested. So absolutely rational. Do these count as COVID deaths? Absolutely should count. How many would I say there are? I don't really know. Okay, I'm an ER doc, emergency medicine, not epidemiology. Second category is people who died of a late complication of COVID, such as heart attacks, strokes, blood clots. We know COVID can do these. They can be life-threatening, can happen up to a few weeks later. I personally have had patients come in with these illnesses without any other risk factors except a previous infection, and these wouldn't necessarily be caught by the death count. Now, should these be called COVID deaths? Definitely. Do I know how many? Hey, I'm an ER doc, not an epidemiologist. I don't know. Third category is people who died of a non-COVID illness because the pandemic had overwhelmed the healthcare system. And this definitely happens. I know at least on one occasion I tried to get a patient out to another hospital that had a specialty we didn't have to get his care. Long delay in finding a hospital because every hospital was full. Even after I got a hospital, there was a long delay in getting a rescue squad to take them, adding up to about an 8 or 9 hour delay in this patient getting care, and he died on the way. So definitely happens. Are these COVID deaths? Well, strictly speaking, no, because they didn't die of COVID, right? Now, they're pandemic deaths, and I guess it depends on how you want to define the death count, but not strictly a COVID death. Now, how many of these were there? Did I tell you that I'm not an epidemiologist and just an ER doc? Don't know the answer. So those three categories all are completely rational ways to help explain the difference between the unexpected death statistics and the actual death count. The fourth category, however, is a lot more complicated. It's a lot more controversial and includes patients who died not of COVID and not because the healthcare system was overwhelmed, but because of other factors related to the pandemic. I can't bring up every single scenario people bring out with this, but I am going to bring up the two I already mentioned because those are the ones people mention the most. And the first one is that one where people delayed care because they were afraid to go to the hospital and they died of their illness. Now, did this happen? Absolutely, people did delay their care. I saw that happen quite often. I didn't personally have anybody who died because of delay in care, but definitely had people who had a worse outcome. So completely rational possibility with the delay in care. The other one I mentioned, suicides, and I'm going to throw in overdoses here because we know both suicides and overdoses were up during the pandemic. Absolutely can help explain the difference between the unexpected death statistics and the actual death count. But one of the problems here when you're going to kind of blame suicides on the response to the pandemic is that, frankly, people are a lot more likely to commit suicide or overdose if their spouse died from COVID than if they actually lost their job from COVID. So I think it's really hard to really pin down a cause in those situations. Were these COVID deaths? Well, obviously not. How many were there? Read it. Emergency medicine, not epidemiology. But I want to tell you something right here. With this last question, there's a lot of things about this that not even epidemiologists are equipped to answer. For example, they're going to be able to tell you how many suicides there were during the pandemic and how many heart attacks, but they don't have the data to tell you how many people died because they didn't go to the hospital or how many people died because they lost their job as opposed to losing their spouse. That data is not there. And you might be wondering why I did the ER versus epidemiology thing, but I did it for a reason, and that's because early on in the pandemic, there were a lot of people posting, some of whom had doctor in front of their name, who tried to give definitive answers to these kind of questions without having the training, they weren't epidemiologists, and without having the data. And quite frankly, I have a new nickname for folks like that. I call them Dr. Online Bozo. And the reason is, if anyone tries to give a definitive answer, whether they have doctor in front of their name or not, and they don't have the data and they don't have the training, you could just call them Dr. Online Bozo. In fact, you can call me Dr. Online Bozo if I tried to give any definitive answers to anything that I'm not trained in and don't have the data. Having said that, I'm a tiny bit worried that maybe I said something definitive without having the training and the data. You could check my videos to see if you can find something. If you do, well, you can actually call me Dr. Online Bozo. Well, there you have it. If you want to know Goldilocks' last opinion on this, well, I would say that the official death count is probably a little low. Maybe it should be 10% higher. But if you want to know the real answer to the question, you got to look to the experts, not moi. So happy days, COVID is in decline, but unfortunately misinformation is not. And I'm going to pivot at this point and start to do some videos on other kinds of misinformation. And I'm going to start by talking about fact checking and how to do it. I've said this in my videos lots of times, we have to learn how to fact check. And thanks for watching. Check out my YouTube channel at DocSteve, all one word, or my Instagram, DocSteve16. But until next time, thanks for watching. See ya. Bye.